The staff have been hard at work authorizing tests and other medical products. As part of these efforts to support diagnostic test development during this global pandemic, the President has asked us, and under his leadership, to actually cut down as many barriers as we possibly could to get medical products into the medical community, and we have done that, of course, recognizing the urgency of the situation. I do want to emphasize what the President said, that we are very much paying attention to safety and with respect to tests, validity, and reliability of those tests. And I think it's really important to understand how far we've come in just a few short months. The academic community, which I come from, the private sector, the government, we've come together to develop diagnostics for a completely new infectious disease. And it's really important. We've heard from many test developers, both in academia and in the manufacturing world. This normally takes years to develop. You've heard Dr. Birx talk about the fact that HIV tests have taken many, many years to develop. This has happened in weeks and months. We've been laser focused on working with both industry and academia to actually make this happen. To date, under our emergency use authorization approach, we've quickly reviewed and authorized 63 tests, both diagnostic as well as serologic, that is the antibody test. We've had several point-of-care tests, and that's important because those can be done in the emergency room, in a doctor's office, et cetera, and much more convenient for the patient. And this week, as the President said, we authorized the first at-home test by a company called LabCorp. This is a test where, under certain circumstances with a doctor's supervision, a test can be mailed to a patient, and the patient can perform the self-swab and then mail it back and get the results after that time, all under the guidance of a licensed physician. And we're not just letting up with these 63 tests we've approved. We are working with more than 400 test developers who are pursuing authorization for their diagnostics under our current policies. And under our regulatory approach, which is quite flexible, many other tests are becoming available. We have heard and have reported to us 220 labs around the country have begun patient testing using their own validated tests.